So I'm delighted to ask our final speaker from this session to come up. Hi, Giles. So Dr. Giles Yeates is very well known in the international brain injury circuit for various things. He's well known for his work on sexuality and intimacy after brain injury. But today, Giles is going to speak to us about more fascinating work on Tai Chi and movement therapy after brain injury. Thank you, Giles.
Morning, everyone. So I love giving these talks because I come with two identities. One is as a clinical neuropsychologist, but I'm also a Tai Chi and Kung Fu teacher and a disciple of the Wu-Tang Clan. You may have heard of Wu-Tang Clan as the hip-hop group, but they call themselves after a group of Taoist monks and nuns in China who are martial arts masters. I'll tell you a bit more about that in a minute. And in Fergus's talk, there was a mention of flow and continuity. And I want us to explore that through an embodied practice today. So, shall we have a go? Shall we think about doing some Tai Chi? Okay, let's have a little snippet of Tai Chi in your lives. So what I would like you to do is just get comfy in your chair. And I want you, if you've got any stuff, just put it on the floor, put it away. And then I want you to take one hand, one arm that's available to you. It could be your preferred arm. It could be the one that's available to you today. And I want you to start to make a circular motion. So I want you to cross your body as if you're scooping something up. And then coming up. And then bringing it across your face. And then coming back down again. That's it. So I just want you to get into this movement. And I want you to ignore everyone else. I want you to become absolutely absorbed in this movement. Perhaps breathing in as the arms come up, breathing out as the arm sinks down. All you are right now is this movement. Let's just do one more. Feeling your body relax down. Breathing in, the arm comes up. And then just let the arm come back down to your lap and relax. Okay. So that was Tai Chi. Tai Chi can be done in lots of ways, in lots of conditions. If you'd like to do more of it, come and join me at 12:30 for my workshop later on. I'm wearing half my robes now. I get to put all my robes on later on. So the work I'm going to talk to you today is a convergence of lots of kind of paths in my life, my threads coming together, which has been absolute honor and privilege to be able to weave these together. So as a clinician, as a clinical neuropsychologist, as an academic, I work at the Center for Movement and Rehabilitation Research at Oxford Brookes University. And as I said, in my non-psychology life, I've been teaching martial arts and doing martial arts for over 20 years. The picture at the bottom right there is me becoming a disciple of the Wu-Tang Clan, and that's my master. Giving me that honor. So I have a responsibility of communicating the martial arts and the lineage and the culture for Europe. And I have a Chinese Taoist name, and it's a big part of my life. So how does it all come together? And what's the relevance of acquired brain injury? So survivors have multiple challenges and tasks after injury. We have, as different professions, we compartmentalize. Psychologists deal with the mind, physios deal with the body. But commonly, survivors are facing concurrent challenges, wanting their body to work better again, to be more controllable, to be more responsive, to have greater agency in their bodies. And perhaps people are asking for more and more physio, and the physio from statutory services run out, but people still want to be working on their bodies. People want to be working on their mind as well, perhaps cognitively managing cognitive difficulties, like we just heard before, managing the emotional and identity needs as well. And there are some aspects of brain injury that traverse categories, right? Fatigue is a huge one, which we'll look at in a minute. Something that existentially drains people. And then there's that spiritual aspect of life after brain injury, which is one of those kind of taboo areas in neurorehabilitation. People rarely set goals for spiritual growth and development within brain injury pathways. I think there's a fundamental existential challenge that's been described in different ways by different clinicians over the years, but a fundamental sense for many survivors of just being existentially different in themselves, often a sense of being fragmented in pieces, the man of the shattered world, or being a shell of a person, or a sense of inertia. There's a kind of vital essence that's not there in someone's being anymore. And in my work, using mainly talking psychological therapies, my sense of that to approach this kind of stuff in a talking therapy would be like to get some sellotape and stick the pieces together, but not address the fundamental rips and tears between those pieces. It was kind of a patch-up job, almost, and we need more options to explore these fundamental existential shifts and challenges. So, with colleagues, we've been trying to develop a mind-body intervention based on Tai Chi, based on what you were just doing just now, to be in the community. That's not a dosage response, time-limited course that happens early on in someone's life post-injury, but to be an option for creativity and identity reconstruction, identity continuity support, membership of a community, and work in a lifelong way, which is what I do. Tai Chi, Kung Fu, these are lifelong practices for me. I will be doing this as long as I'm able to. It's part of my life, not a little burst in time. What would it be like to have that kind of a project, a lifelong project for survivors of brain injury? I think fatigue, I want to go back to fatigue, because fatigue is something that, again, traverses psychological input, OT inputs, physio inputs from a professional perspective, traverses mind and body, and there's this fundamental sense of being absolutely depleted. And in terms of technologies and approaches to manage that, we have quite limited sets of options. So I can come back to that. Okay, so just a quick nod to, is this just some hippie rubbish? Is there any evidence base to support the value of Tai Chi interventions in neurological conditions? So I'll do a quick overview and you can get into the detail later on. So across neurological conditions, there's good evidence for gains from Tai Chi practice for balance, coordination, postural control, mobility, aerobic endurance, and reduction in fall rates and fear of falling across conditions. But also moving in from the physical to the psychological, reduction in pain. We'll come back to the fatigue story, which is really interesting. Improvements in psychological functioning, mood, quality of life, and independence across neurological conditions. Then by neurological conditions, the strongest evidence for Tai Chi currently is in Parkinson's and stroke. Because there are a couple of smaller studies for traumatic brain injury, but they're growing across time. Okay, so just going back to the fatigue story. So the kind of standard idea around fatigue management is, okay, post-onset of a neurological condition, your energy pie is smaller now, so you have to be more strategic with how you consume the pie, how you divide up the pie. That's kind of the main idea about activity pacing and rest in managing fatigue. There are obviously additional approaches now with different kinds of stimulants, use of melatonin and things like that. But a lot of those have side effects, and there isn't yet something that tries to increase the energy pie, increase the energy from which vitality can be drawn across the day. Tai Chi comes from a kind of a different worldview from a Chinese perspective that holds the idea of energy movement around the body. That's cultivated through work on the breath and intention, relaxation in the body. But there's interesting ideas that are relevant to us in rehabilitation. So there's an idea that energy can be depleted. That energy would be called qi from a Chinese perspective. But there's interesting ideas like stagnant energy. That is a hydraulic metaphor that in the same way, if water can't flow through a pond or a lake or river, then you can get stagnation. It's the idea that if energy can't circulate, energy can get stagnated and you can get excessive energy that doesn't serve a purpose. And maybe as survivors in the room or clinicians, work survivors, you'll have that experience of seeing someone who's both fatigued and has a lot of movement, like a lot of restless movement in their body. So energy is being expended while experiencing fatigue in the body. So that's something that's not really in the clinical fatigue story, I don't think. So my masters in Wudang Mountain are famous for their work on energy. I don't know if anyone's seen the movie Crouching Tiger, Hidden Dragon. So the monks that have trained me have cultivated using energy practices to the point where, in the movies, they're depicted as being able to run up trees and stand on the top of trees. I have seen my master do that, actually. But more frequently, they do a kind of form of parkour where they run up walls, like Roadrunner used to done in the cartoons. And their ability to do that is through cultivating, challenging their energy to such a point they have this kind of explosive release and superhuman abilities. So there's this ancient practice of cultivating and challenging energy, which I think is really interesting. And then if you look back to the literature across studies of mind-body interventions, Tai Chi, but also things like Qigong, yoga, mindfulness approaches, there's a consistent story of gains in fatigue management, reduction in sleep disturbance. What's interesting, none of these studies kind of operationalize fatigue as a primary outcome. It's often a secondary outcome, and there's not much attention paid, but there's a consistent study that there's some tallying of kind of Western evidence base and ancient Chinese perspectives about energy cultivation, that these kind of practices can add perhaps a third way of dealing with depleted energy. So what happens in Tai Chi? Because Tai Chi isn't just about the external movements. Hopefully when you did those movements for me just now, you weren't too preoccupied about how well you were doing it. And maybe I said you were taking my invitation to be absorbed in that internal world of movement and flow. In Tai Chi practice, from a Taoist perspective, that's called Neidan, and that refers to a movement of energies and a changing of energy states in the body, without getting too esoteric about it. And this process happens through multiple activities: Tai Chi, but vibrant martial arts like Kung Fu, also gardening, an approach to nutrition and cookery, architectural design, the creativity work that Fergus was describing, anything that invites movement and continuity and flow. So let's go back to the idea of a survivor who experiences themselves as being in pieces. So a talking therapy, we can maybe put sellotape over that, and the pieces still remain fragmented. But I'd like you to think about things in a different way. If you think about leaves in a stream, they are all individual pieces, but when they are organized by something bigger than themselves, like the current or eddies of that stream or river, they all move as one. And this is what a mind-body approach like Tai Chi, done in a group, can offer. It's something bigger than yourself that holds you together during the movement. So learning a sequence or moving a sequence moving together with other people. Think about a shoal of fish or a murmuration of starlings, all moving as one. And there's an invitation, if it's part of your experience, to think about being organized by something even bigger than yourself, a spiritual force, or a higher power, moving together, being held in the movement, not being fragmented anymore. The other thing about these talks, I get to quote Bruce Lee, which is kind of cool. Bruce Lee talked about this state of being like water, having the qualities of water. And this takes us to a word that Fergus introduced, flow. And part of the positive psychological work that Professor Evans and colleagues have also been exploring. So being in a state of flow. You may know what it's like to be in a state, being in the flow. We've heard that concept. And I invite you to come and join me at 12:30 to try and experience that in a more absorbing way as well. Flow overlaps with different concepts. There's a concept of, like I said, study from a Western psychological perspective. It's studied from a kind of idea of a liminal space, so the space is in between wake and sleeping, between different life stages, between movement. I've traveled this morning. So when you're in between where you were and what you're about to do, who you were, what you're about to be, that space in between is considered sacred by the Taoists, actually. And it offers opportunities of not being defined and pinned down by one state. So we're interested in exploring that concept, that experience of flow as part of Tai Chi practice after brain injury. We're also interested in studying its neurological correlates. So let's see, So this is me doing some Tai Chi movement using a neuroimaging approach called NIRS, Functional Neuro-Infrared Spectroscopy. We're trying to see what happens to the brain when doing these slow, absorbed movements, and if there's something unique to brain states in this kind of practice. So we're in developing this work at the minute. In terms of Tai Chi as a practice and evidence base for that, the thing about the Tai Chi literature, it's not really been studied from a psychological perspective directly, and to explore how flow can be optimized to make Tai Chi accessible to multiple people. Because after brain injury, people have different physical, psychological needs, different combinations. So different movements within a Tai Chi repertoire will be accessible to some and exclude others. So we've started to build up an approach to this. Well, first of all, we did we got a pilot study where we had a group with a range of people with different kinds of psychological, cognitive, and physical needs doing the same group format. And this is an example of the group.
That's fine. And then drop them down, nice and relaxed.
So starting off with
Sort of drag your hands up your body. Still
some
palms
accessible meditational movements, standing or seated. Then progressing over the weeks to more complex movements. Again, that can be done from a seated position or walking or standing.
next to each other. Open your toes. Turn to the right. Angle the breath.
And this group was over 6 months as opposed to a few weeks. We wanted to see the progression and the experience of being in a Tai Chi group together over that period of time. This is towards the end of the 6 months period. This is the development of the movement that we were doing just before. It's called cloud hands, and you can develop that movement to do it while walking and doing it with both arms. Okay. So I can. We released the paper a couple of years ago. I can get you a copy of that paper if you get in touch. And we did some case studies from the paper in the following books. So in that study, we found that some people found, as we would expected, found different aspects challenging, but there was a shared experience of relaxation and energizing at the same time. And across the quantitative data, lots of variability across measures of different mood and things, but again, the fatigue story was the most consistent aspect. Should we go back to the exercise just before we finish? Yeah. So you know what's coming now, right? So maybe it'll be a little bit familiar. So let's repeat. So again, take your preferred arm, sit into your seat. Bring the arm across your body, bringing it up, taking it across the face, and bringing it down again. Breathing as you come up, breathing out as you sink down. Just notice it's a little bit more familiar now, maybe a little bit less strange. So those qualities invite something more from doing the movement. Let's do one more. And relax. You guys look amazing, by the way. You all look like Tai Chi masters. Yeah. So this idea of repetition, learning movements, and being held together in these movements, we think there's some real value here. And we want to kind of channel that quality. So moving forward, we're starting to develop evaluations where we are selecting specific moves for particular people to optimize their experience of flow. So if you did a Tai Chi movement and it was really difficult and you're really critical of yourself, I can't do it, I'm not good enough, you're not doing Tai Chi. You're just doing something that makes you feel like shit, and amongst other things that might make you feel like shit the rest of the day. This is supposed to be an opportunity to feel different. So finding the right moves that are going to be interesting and challenging enough but accessible is key. So we want to develop a research program along that basis. And the idea is that state of flow, people get to the same place, but it's like going through different doorways to the same place. Some movements will get people in one way, different movements will get people the other way. And to that aim, we did, during COVID, during lockdown, with the Different Strokes charity, we did a range of 65 sessions of online Tai Chi, adapted in different ways to different people. We're evaluating that, but that's available online. If you wanted to do some Tai Chi with me online today, you follow the details in this presentation, and you can start doing it because it's free and available. And here's the, if you want to take a photo, here are the links to get you there. All right, thank you guys.
Thank you, Giles. Always fascinating. Thank you so much.